I am the new person on the block. I became State Health Commissioner on June 1st, but I have been with the Department of Health for the last 3 years as the Chief Medical Officer. I'm an ER doc by training. I still work every Tuesday in the ED. It's important for me to continue to see patients. I learned so much while I'm there that I can take back to my job in the health department. And vice versa, I think I've become a better doctor since I've been in public health. And we really have an amazing team at the agency. So Pam has been with the agency for over 30 years. I think some of you may know Amy Kent, the Chief Strategy Officer. She's the person that's going to be really helping with the implementation of the legislation. Shane Hatchett is our Chief of Staff. He's also been around for some time and knows the ropes of everything. And the team is very deep. It goes on and on to help provide support for everybody. So I want to make sure that we are able to answer questions and kind of open it up for conversation about what you guys are talking about and thinking about. I really am so glad that the stakeholders from the community are here, because that is also, bottom line, the most important thing about this legislation. It's not really for the health department to just say, here are all the things. It's really for the community to come together and say, what are our biggest health issues that we need to address? Is there someone in the community that's already doing it and they just need a little bit more funding to expand? Or is there someone in the community that would like to be doing this, but they just need the support or are best suited to do it and they need the support? Some counties that we talk to, they're like, yeah, we have this great program, but it's only in the city, and we're going to use this funding to help expand it beyond, right? And I think no one best to know that than those people engaged would be your hospitals, your clinics, community-based organizations. We're excited about the future, and we're here to support the counties, whether they opt in or they decide not to take the funding. Either way, many of them have come to us and said they need some help with it. So we are up to 30 counties who have already opted in, so a third of the state. Hi, how are you? I think some people were surprised the first counties to opt in were our rural communities. Senator Kenley, who helped lead this initiative, has said over and over again, and I agree, this has been the biggest investment that we've done in our rural communities, looking at all legislation, because it truly gives them funding and says, you rural community can use this where you need it. So some of the rural counties we've talked to said, we have a lot of farming accidents, so we're going to use some of the funding to address this. Another one said, we have kiddos that are getting injured from being improperly restrained in their car seats. And there's things that we can do. So I'm also talking to businesses across the state. So I've talked to the Indiana Business Alliance. We're talking to the Chamber later this week. And the businesses have been honestly the most enthusiastic about the potential of this. So they're trying to recruit employees into their communities, into the state, and they have recognized that young people want to live in healthy communities. And so they're excited to be able to share with people, look at all these great programs are getting implemented in my community. Look how we're improving healthcare. They also recognize that healthy employees is a good thing for the bottom line, right? We need to have healthy people to be able to make the business go round and round. So they've been really excited about it. Some of them have specifically said, so who are my county commissioners and how do I reach out to them? So I'm like, here you go. Here's the website. You know, if you want to have a conversation with them, this is the direction by which to do it. So this is one of these initiatives that will continue to bring all of our communities together.
What I was going to say was we have been talking a lot within our health department about the possibility of effectively a care team. I should look at my wording here that we came up with, but what it would do would add a care coordinator. So, and that it's a bigger job than I think people like, yeah, sure, I can tell you here, this is this resource, this is this resource. But as we were saying, when people are in a bad state of mental health, they're not going to take a card and leave your office and go, oh yeah, I should call that number, right, and talk to somebody. So
and
they have somebody,
transportation,
right,
or
that too.
Yeah.
Oh yeah, that also comes up all the time in our various kind of committees and things that we are on, and that would be transportation was something that we put in our plan to help too. But so care coordinators, they have to know who's out there and what is available and who to make that contact with, how to make that appointment, actually sit with the client and say, well, let's go ahead and test that your friend was diagnosed with, so that they would have the ability to do that, but that also, I see that it's really important to have someone that knows the people involved in all these programs too, to know who the contact. The other thing that we are finding is that we really want to do the data well. We want to know what's out there and know what needs there are, and some of that is we're getting our web of community partners, and it's everybody. I mean, it touches everybody somewhere. It's an extensive list. We are in Northwest Indiana. That's a little different than some areas. We're not a primarily any kind of rural farming area. We're not a primarily suburban. We are kind of an industrial area, and that changes the kind of health outlook for employees across the county in terms of people here just work hard, and they work long hours and odd, just night shifts, and it's just and it takes a toll. It really, I see it, when I was in continuity clinic, it just all the time. The obesity, the diabetes, the alcohol, and the tobacco, because they all work effectively outside. They can still smoke at work, whereas a lot of people can't anymore. But we see that in Northwest Indiana. So those are some of those things. Just getting the industrial employers on board too, knowing what services are already out there, because a lot of corporations have really kind of robust wellness and mental health things too. As I still work for the hospital just put in place a really strong, what seems to be a really strong EAP program with somebody like in person at least one day a week, and then the ability to do mental health stuff too easily, which is huge. And so we need to know, are there barriers to people accessing their employee programs, and how can we fill those gaps? So,
can we have any telemed here or not?
At the health department?
Yeah.
And the only telemed we do is tuberculosis, taking your pill. Yeah, that's it. So, no, we don't have that opportunity here. But that is something that could be added on. Yeah. So, this is a big tax. It really is. It really is a big tax. So, we're looking to reach out to lots of people to get help and ideas and come up with a very good plan.
I know we want to talk to you about just water testing.
Right.
That's the whole industrial. We're unique here in that we have such a heavy industrial component.
For city drinking water, or for well water type things? Groundwater.
Yeah.
Yeah.
Because we go around and we test for sediment with the stormwater. We go around and test for sediment everywhere, and they keep track of everywhere they're testing. I think it would make sense for us to also do testing water, because that can affect well, it can affect well, it can affect.
This legislation came about with us working with the Association of Counties, with the Association of County Councils, with mayors, with really local people coming forward and saying this is what will work, right? And then giving the control over to the local community. So what you see is what you get.
At the Indiana Department of Health for 33 years next month, and have never seen an opportunity like this at the state level to support public health. This is new. It's really unprecedented, and I think it really shows the commitment in a very transparent look at the state of health in our state, and being very intentional about how we can improve it and move it forward, but doing it from the local level, where communities, local health departments, partners can really see what the needs are there and what solutions are going to work for them. It's not a cookie cutter, one size fits all, because every county has some different nuance or flavor, and so really being able to work with your own partners and use these dollars for maximum benefit for your communities is what's truly important, and preserving that local control throughout the legislation, because that's really where the rubber meets the road of public health, is what we're doing for our individual own communities based on our data, being able to leverage our partnerships for maximum.
Thank you guys. Honestly, huge. I mean, thanks to the governor for recognizing it, to the commission for doing the work, but the legislators are the ones that said, this is a problem and we can't just keep on saying it's a problem, we're gonna do something about it. So thank you. Appreciate it. Yeah.
Thanks so
Thanks
much.
for coming.
Thank you for having us.